Okay, so good morning, everyone. Good morning. Ohayo gozaimasu. It is a great pleasure for me to be part of this significantly important group and the discussion that is going to take place, which I'm very much looking forward to learn from. I just started this morning by talking about conference of stage party, which just ended yesterday. Even though this is a week of the conference stage party, so this side event is still part of the conference work. But over the past 3 days, there's so many references to the importance of data statistics on disability, and also information concerning the situation of persons with disabilities during the past month under the COVID-19 crisis and the current ongoing recovery and building back better processes. And I really believe that this group will be able to discuss solutions in response to those questions from policy side, especially those speakers who are at the front line and who really wanted to actually identify a solid evidence for them to be able to make the case for persons with disabilities to be included in their operations, in their services, in their decision-making processes for the communities, again, measures, against all this, adverse impact of continuing impact of COVID-19 pandemic. So I just wanted to preface my introduction to saying that this group and this your community, your respective leadership in your own communities will have a huge role to play in the coming months and years to address the inclusion of persons with disabilities in our society and development, as was the commitment of the United Nations for the past decades, and also the CRPD's commitment to ensure that persons with disabilities are an integral part, and also not only as participants, but as agents of change and leaders. And we have all of those terminology, we have all those policy imperatives that we are pursuing in our respective work, but we cannot really, we don't have a solid standing on evidence. We have been addressing this, and we have been again, calling for more action, more resource, more expert networks to support again this, the implementation of the human rights of persons with disabilities in the context of CRPD implementation, or in the context of disability inclusion in the 2030 development agenda. So I think I hope that our work also that we did in 2018, which was the UN flagship report on disability development, which gathered together data statistical information relating to persons with disabilities and their situation in the context of SDGs. Could also provide a basis, and then we are currently in the process of updating the information contained in this report. General Assembly resolution last year on inclusive development for and with persons with disabilities clearly requested to all of us, to the UN community, that we need to give more strength to what we had already provided. In relation to the evidence base for all our action in the disability field, whether it's human rights or humanitarian front lines, we actually are very much in a dire need of your work and then of your leadership in making again this evidence available to all of our work. And just to add, I have my colleague, many of my dear colleagues here that I've been working with and that I've been learning from for so many years, including, of course, my Professor Michael Stein, and of course, my colleague from my own department, Miss Margaret Mngoni, and of course, Charlotte McLean, Miss Charlotte McLean from the World Bank, and also the government of Philippines over so many years, we work together as the international community with a focus on disability to advance this issue of disability statistics. I think Margaret knows, but then we, in our Department of Economic and Social Affairs, we started again the work on disability data statistics in 1980s, and the first disability data statistics. This program was started by our colleague, Miss Mary Chemi, who since retired for many years, but her work started in 1980s, and then also that resulted in a number of DESA's concrete products, in terms of promoting guidelines. We also have statistical data portal since 1990, which I think Margaret is going to discuss more in detail as to what the status is and what is it that we are now looking into, as a department to make contributions to this important field. But I just wanted to add my voices to all those COSP speakers, all the governments, and all of our civil society leaders, that we really have to work very hard to make the case for persons with disabilities. And we really need your support and work and your partnerships. And I just would like to thank you once again. I would now like to ask Professor Sophie Mitra to continue with this, with this side event. And I must apologize that I have a few commitments that's still pertaining to the conference work, and I will try to be back a little bit later. So thank you so much, and I'd like to turn it over to Professor Sophie Mitra to lead this important discussion.
Thank you, Akiko, for your introduction. And for your leadership in organizing this side event. Hello, everyone. The script of my talk is available on a website. The link is copied in the chat box. I just entered it. Is my sound okay?
Yes, yes.
All right, thank you. So I will start with a few acknowledgements. The Disability Data Initiative is the work of a team at Fordham University, including 8 students and myself. Students are in economics, disability studies, and computer science at bachelor, master's, and PhD levels. I would like to express my deepest gratitude for their excellent work, dedication, and patience over the past 18 months. With the pandemic, it was for all of us a very challenging time to work on a new and large project such as this one. I also would like to thank the steering committee of the initiative for their invaluable guidance and encouragement in the past year. Later in this panel, you will have the privilege to hear from 2 members of the steering committee, Margaret Bogoni and Charlotte McLean-Lapo. The Disability Data Report is co-edited by Jacqueline Yap, PhD candidate at Fordham University, and myself. Jacqueline will be available during the Q&A. The Disability Data Initiative is made possible thanks to funding from the Wellspring Philanthropic Fund and from the World Bank Trust Fund for Statistical Capacity Building under the Inclusive Statistics and Data Project. So why a Disability Data Initiative? 182 countries have ratified the United Nations Convention on the Rights of People with Disabilities since 2006. Many countries have also developed national policies and legislations towards implementing the convention. Have the rights of persons with disabilities been realized? Perhaps in some countries only. For countries where rights have been realized, what is it that worked and how? These questions are difficult to answer. Developing answers requires collecting and analyzing data. One option is to gather environmental and policy data to identify changes that are required in terms of physical and social barriers. Another option is to have a qualitative and participatory exercise involving several stakeholders, including persons with disabilities and disabled people's organizations. While these options may go a long way in understanding the situation of persons with disabilities and informing policy and advocacy efforts, they would not provide nationally representative information on individuals and households and may be difficult to compare across countries. That is where national statistics based on household surveys and censuses can be useful. They can provide estimates for indicators that document whether equal rights have been respected. For this, statistics need to be based on concepts that are in line with a human rights approach to disability, disaggregated by disability status, and reflect various aspects of the lives of persons with disabilities and their diversity. This is particularly important during the pandemic, when disability prevalence may have increased and disability inequalities may have been exacerbated. The Disability Data Initiative and its report provide the first systematic analysis of what is often used as a source of disability statistics, that is, national censuses and household surveys globally. It also takes advantage of the increasing availability of internationally comparable disability questions by analyzing 41 countries' national census or survey data to produce 30 indicators disaggregated across disability status. Results are available in a report and in tables on a new website. And the website is https://disabilitydata.ace, I spell it out ACE.Fordham, I spell it out FORDHAM.edu/. The report goes over the main findings across countries. Its methods are explained in method briefs. The main results at the country level are summarized in country briefs. Detailed results are available in Excel tables you can download from the results tables page. So what are the key findings? Let's start with the review of data sets worldwide. This report finds that disability questions of any kind are absent from 24% of countries and 65% of household surveys and censuses. The general question, do you have a disability, remains commonly found in censuses and surveys, although it does not produce meaningful and internationally comparable data. It is unclear what such a general question measures, as disability may mean different things to different people. Also, disability is often stigmatized, and therefore survey respondents may not feel comfortable answering this general disability question. Disability questions that meet international standards of comparability have been adopted more and more. What do these international standards of comparability refer to? We consider questions to be internationally comparable if they are consistent with the recommendations of the United Nations Principles and Recommendations for Population and Housing Censuses of 2017. They need to ask about functional difficulties in at least 4 domains: seeing, hearing, walking, cognition. They may also have questions on 2 other domains: self-care and communication. We find that only 84 of 180 countries and 16% of the household surveys and censuses under review have internationally comparable functional difficulty questions. Overall, in many countries' national household surveys and censuses, persons with disabilities continue to be invisible. Therefore, many countries' national household surveys and censuses do not provide the data that is necessary to monitor the Sustainable Development Goals for persons with disabilities. And much work remains to be done to implement Article 31 of the CRPD, which requires that state parties, quote, collect appropriate information, including statistical and research data, to enable them to formulate and implement policies to give effect to the present convention, end of quote. Let's now move to the results of the analysis of survey and census data. This report presents an analysis for 41 countries with functional difficulty questions collected between 2009 and 2018. It is one of the first international efforts to document functional difficulty prevalence and education, work, health, standard of living, and multidimensional poverty indicators for adults with and without functional difficulties. Earlier efforts used data from the early 2000s, in particular the World Health Survey. Other efforts put together results from data sets using a variety of disability questions and that were not therefore strictly comparable across countries. How were the 41 countries chosen? These are countries for which we had access to national household survey or census data of the past decade, and that are deemed internationally comparable, meaning that they have questions on functional difficulties in 4 core domains. For 28 countries, data is also available for the self-care and communication domains, including 21 countries with the internationally tested Washington Group short set of questions. The disability data report provides results on functional difficulty prevalence and on indicators on education, work, health, standard of living, and multidimensional poverty for adults with and without functional difficulties using several disaggregation methods. Because 6 countries only have yes/no answers to functional difficulty questions, we first compare persons with any difficulty with persons with no difficulty. For 35 countries with a graded answer scale, we can differentiate by degree of functional difficulty and separate persons with some difficulty from persons with at least a lot of difficulty. We disaggregate by functional difficulty status and also in turn by sex, rural, urban residents, and age groups. In other words, we estimate indicators for women with and without difficulties, men with and without difficulties, and so on. These findings are in the results tables on the website. So what do we find? Some of the results are not going to be a surprise for many people in this space. I will present 4 main results. First, we find that functional difficulties are not rare. Across countries, the median share of the adult population with any functional difficulty stands at 13%. This finding is close to the 15% global estimate in the World Report on Disability by the WHO and the World Bank. The median share of households with adults with functional difficulty is at 28%, so more than 1 in 4 households have a functional difficulty. So these findings go against the commonly held belief that persons and families with disabilities are a small minority. Second, this report finds significant inequalities associated with functional difficulties in terms of education, work, health, and standard of living. By standard of living, I mean adequate living conditions, such as housing or having electricity. A disability gap, which is a disadvantage for persons with functional difficulties compared to persons with no difficulty, is consistently found across countries in terms of educational attainment, literacy, food insecurity, exposure to shocks, asset ownership, and health expenditures. In addition, for a majority of countries, there is a disability gap for the employment population ratio, the youth idle rate, the share of adults in informal work, living conditions, and domestic violence. A multidimensional analysis, either by considering the multiple deprivations experienced by an individual or country level results on an indicator by indicator basis shows large and consistent inequalities. An interesting finding is that for many countries and indicators, there is a graded association between functional difficulty and a disadvantage. In other words, persons with some difficulties are worse off than persons with no difficulty, but better off than persons with at least a lot of difficulty. The group of persons with some functional difficulties should therefore not be ignored in research and policy, and data on functional difficulties should be collected with a graded answer scale rather than yes/no answers. Finally, we also present indicators by type of functional difficulty. While inequalities are found for all types of functional difficulties, the largest gaps are for adults with self-care and communication difficulties. Overall, the results show that policy work is needed to curb the inequalities across disability status and realize the CRPD. The stark inequalities shown in this report highlight the urgent need for policies in education, employment, healthcare, and social protection. So what's next? Another report is planned for next year. It will update the review of national household surveys and censuses and their disability questions to cover 2019 and 2020. We will analyze data sets for more countries, including some in the global north. We look forward to feedback from panelists and the audience to inform the work of next year. Thank you very much for your attention, and I will pass the floor to Mr. Rojas.
Thank you very much, Sophie. The National Council on Disability Affairs is the national government agency mandated to formulate policies and coordinate the activities of all agencies concerning disability issues and concerns. SDA also monitors the implementation of the CRPD in the Philippines. In the Philippines, the census of population and housing is conducted every 10 years and in 2010, the recorded number of persons with disabilities is about 1.44 million, or 1.57% of the 92.1 million population. In 2016, the Philippine Statistics Authority conducted a National Disability Prevalence Survey, or Model Functioning Survey, adopting the Model Disability Survey developed by the World Health Organization and the World Bank. The MDH is based on the International Classification of Functioning, Disability, and Health. The survey resulted in 12% severe disability, 47% moderate disability, and 23% mild disability, while 19% experienced no disability. Moreover, almost a third of the population aged 60 and older experienced severe disability. The PSA used the ZMDH in the 2020 census of population to validate the earlier results generated from the 2016 survey. The results are not yet released, but meanwhile, the data captured by the Department of Health coming from the issuance of disability identification cards represents only 26% of the total number of persons with disabilities in 2010. The reason is the low turnout. Well, was probably because of the network and internet availability. On the other hand, NCTA is monitoring of disability ID card issuance in the capital region represents 2% of the region's population in 2015. This data is a reflection of the World Health Organization estimates in 2011 that about 2 to 4% of the population experiences significant difficulties in functioning. The challenges disability definition in the Philippines is anchored on the presence of impairment as defined by the Magna Carta of persons with disabilities, while disability based on the International Classification of Functioning Disability and Health is based on experience. In a lifetime, all people will experience a decline in health conditions and thereby will experience some form of disability one way or another. It is a universal human experience in a life continuum. Therefore, the differences in figures as to the total number of persons with disabilities are results of differences in the operational definition of disability. The Philippines recognizes the importance of identifying functional limitation of people based on a set of criteria such as the Washington Group of Questions. However, we cannot undermine the importance of identifying the prevalence of disability based on impairments as a result of health conditions, by accidents, and those recognized by law as having such disabilities. This is primarily the basis for developing disability appropriate programs and services, such as those needing assistive devices and technologies, captioning services, sign language interpretation, accessible websites, and accessible learning materials. We also recognize the need to harmonize these definitions so that they will be complementary with each other, highlighting the scope of functional limitation in the country and at the same time giving emphasis on the number of various classifications and categories of disability. The Philippines is committed to addressing these issues and gaps in developing a sustainable disability data collection mechanism by setting up a data system infrastructure that would systematically collect disability data as a result of programs and services at the local government units up to the national level. Conclusion: disability is a progressive and evolving concept as recognized by the CRPD, wherein people with impairments interact with various barriers in society, such as the environment and attitude of people that hinder their effective participation. Hence, the existing definition of how we look at disability would eventually adapt to the changing times and requirements to realize the rights of persons with disabilities in general. However, the main the fact remains that we need to deal with impairments and barriers that create disabling conditions. Our data must be based on evidence and complemented by estimates gathered from surveys. We should be able to account for each person with disabilities and provide the necessary services and programs we deserve to realize the mantra of no one left behind. Finally, we we still need to identify the impairment to directly address the specific needs of persons with disabilities. However, we fully support the creation of comparable data in line with the directions of the United Nations. Thank you very much.
Thank you very much. Now we turn to Jose Vieira.
Sorry, good morning, good afternoon, good evening, everyone. Let me first thank the organizers for putting this great side event together. And I would like to share at least three key elements out of the discussion so far. The first one is that it is clear out of the report that we are discussing today, but also from other reports and documents related to data and statistic, how invisible people with disabilities are when it comes to data and statistic discussions. And that, of course, is indeed an issue, because without making visible this population, we are definitely missing a huge component of any potential planning or policy design process. But at the same time, because the fact that we are not visible, we cannot be part of the discussion. And that actually connects to the second point that I would like to highlight here. And that is, if we really want to ensure that slogans like "no one left behind" or "nothing about us without us" come true, definitely we need to arrange whatever is necessary to ensure that people with disabilities are meaningfully engaged in the discussion. And when I say discussion, I mean from the design, implementation, and monitoring stages. And I clearly see that as long as we continue not doing even more efforts around promoting the people with disabilities centered approach when it comes to statistics, we will continue facing the same issues that have been highlighted in the previous interventions. So if visibility is one issue, the lack or I would say the need of more meaningful engagement of persons with disabilities is the second key element. The third key element is that for people with disabilities and their representative organizations to play an active role when it comes to data and statistic, we really need to do it from a perspective that will enable people with disabilities and their representative organizations to comment on policy making processes, to influence policymakers, to be at the center when it comes to the design of programs, whatever those programs are related to health, employment, education, etc., etc. So by the fact that we are preventing people with disabilities to access the world of data, but at the same time, by not including people with disabilities in many of the data efforts, we are in the end preventing people with disabilities to influence program and policies that have a direct impact in the life of people with disabilities. And this is sort of the analogy that I would like to share with you. If we really want to sort of close the circle in which we started by including people with disabilities, and then we increase the visibility of people with disabilities, where we are going to get to, it's basically a stage in which people with disabilities and their representative organizations can influence and be key players in all policy programs and even legal reforms when it comes to the implementation of the Convention on the Right of Persons with Disabilities. So if we really need to understand, if we do understand the situation, studies like the one that has been presented today, joint efforts like we are seeing across many organizations, universities, governments, etc., etc., I would say is the right path to ensure that no one is left behind. More capacity building for OPDs, more training and useful tools to equip our organizations are definitely preconditions to promote full inclusion of persons with disabilities. I'll pause here, thanking again Sophie and all the people involved in this study, because I believe the more we are involved, the farther we can get. Thank you, and I will now pass it over to Margaret. Thank you.
Well, I don't see me on the screen. Hopefully you can see me. So good morning, good afternoon, good evening, wherever you are. I'm honored to represent my office in this side event and to have been part of the report that that has already been presented to you. In my remarks, I'm talking about the value added to what countries do, the value added by detailed analysis, such as this one, on the data that countries have collected. In all our on all our recommendations that come out of the UN Statistics Division, including on disability statistics, on population and housing censuses, and in other areas of our work, we recommend to countries that while they are able to analyze the information that they have collected, there is value added by having researchers and academicians carry out more detailed work than is normally the case with the national statistics offices that collect the information. But I'll give at least 3 examples of how what has been done through this project not only complements what we are doing, but slightly differs, but this is done in a positive way. As you already heard from Akiko, and as many of you already know, the UN Statistics Division Disabilities Program started in the early 1980s at the time of increased international interest in the situation of persons with disabilities as a result of the International Year of Disabled Persons in 1991, then the decade that was passed in 1982, and the World Program of Action concerning disabled persons in 1982 also. These international landmarks recognized the importance of data for comparing the lives of persons with and those without disabilities so that appropriate action could be taken, most likely or mainly by the countries where these persons live. And these landmarks recognized the importance of data, and as a result, the UN Statistics Division published in 1988 the first database at the time known as DSTAT. And it had data from around 100 countries and was the first international comprehensive disability statistics database of its kind, with the data from population censuses, household surveys, and administrative registers. And the last update of this database was carried out in 2018. And this was done in the context of the 2030 Agenda for Sustainable Development and leaving no one behind, including persons with disabilities. And this latest update came with a major overhaul regarding the visualization of the data through what is now termed the United Nations Disability Statistics Data Portal. So now I will go over quickly the three areas where there are differences in a positive way between what we have done at the UN Statistics Division and that what is being presented today. For example, in our database, UNSD presents all data from countries irrespective of the source, that is, whether they are from censuses, from surveys, from administrative sources. This is because being an international organization, we have to present what countries are producing. And in the context of this research, the researcher can choose what they want to do in order to highlight the messages that they want to present. And also, in terms of what we do, we present regardless of the methods used. I mean, regardless of the questions that the countries have used. Whether it's the Washington group questions or whether it's some other kind of questions. That said, we do that because that's what countries have provided, but also so that countries can learn from one another. If a country is using what is being recommended in UN guidelines, including what Sophie has already mentioned, and another country is not using or following those guidelines, they can relate their results to one another so that the one not using the recommendations can learn to see if they were to use, this is what they would get, and so that they can follow those guidelines maybe in the future. Also, the current analysis looks at only those countries that used questions that are deemed internationally comparable and include the questions used by the Washington group, as well as those that that cover difficulty functioning, but may not necessarily use the same wording as the Washington group short set of questions, as well as the answer categories. Secondly, in line with its mandate, UNSD collects data from countries and publishes them without any major changes to what countries have submitted. For example, for countries that have used the Washington group set of questions, rates are presented according to cutoffs that are determined by the countries, while some follow what the Washington group has recommended in terms of cutoffs. Some include more than that because they think the rates using what's recommended is too low, and they include other categories. That said, if we have a workshop, for instance, we recommend to countries that they follow the guidelines and not try to have a higher rate that does not follow what is being recommended. But for this research piece under discussion, a similar threshold is set for all countries being studied so that results are consistent across all the countries and in line with the intended outcome of the analysis. Lastly, in the data portal that's maintained by the UN, the data are based on macro data, that is data that are already aggregated and tabulated by the countries, because this is in line with our mandate. We do not make changes to the data that the countries have produced. But with the researchers, including what has been done today, the data are presented are based on analysis of microdata that are analyzed in a way that makes the results consistent across the countries. Also, a value added of this kind of analysis is that it enables multivariate analysis to identify more correlations and causations between, for instance, having a disability and low education and any other topics that they deem necessary. And this is really important to the countries where the populations live, so that targeted interventions can be implemented. So thank you for your attention.
Charlotte, you have the floor.
Thank you very much, Sophie. Good morning, good afternoon, good evening to everybody. I'd like to thank the organizers very much for putting this side event together. And just want to underscore the importance of the report and the analysis that we're discussing here today, and the value of the Disability Data Initiative. And I'm looking forward to how we can really begin to build that up more. I want to pay a lot of respect to Professor Mitra for leading this work, and it has been a pleasure to be part of the steering committee. What I wanted to do with my time is to provide a bit of an update in terms of what we've been doing at the World Bank around advancing disability inclusion data, because I think it dovetails very well with this analysis. And to do that, I need to step back a bit and say that at the Global Disability Summit in London some two and a half years ago, the bank made a set of policy commitments. And within the 10 commitments that the bank made, there were specific commitments around data disaggregation using the Washington Group, as well as a project to collect data around women and girls with disabilities. And so what we've done to support and to monitor those policy commitments is to establish a working group that gets regular feedback on how these commitments are advancing. And so on the data commitment, the poverty team developed an Excel-based tool called the Survey Scorecard that reviews questionnaires to determine whether they include the Washington Group short set of questions on disability. This will be a tool that will be able to tell us how many countries have incorporated the Washington Group short set in their household surveys. So that's very important. Once the results are available, the poverty team will share them with the disability inclusive team, and we will work on a joint analysis of countries that include these questions. And no doubt this will have will build off of the work that Sophie has already begun to do. One of the other commitments in the 10 commitments was a commitment, as I mentioned, on women and girls with disabilities. And what we've done in that regard is to include 4 questions on the legal framework of women with disabilities in the Women, Business and the Law's Family Law Survey. And we have now analyzed 176 economies and have preliminary data on those. The second phase of the Women, Business and the Law project has just kicked in. And what we're doing right now is to have additional questions looking at the rights of women with disabilities. The sectors that we're exploring at this stage are employment incentives, reasonable accommodation, intersectional non-discrimination, and protecting the protection of parental rights, as well as looking at laws that protect women and girls with disabilities from violence. So that is ongoing work around data collection. Now, what's really important about these 10 commitments is that they then influence the policy commitments within the IDA 19. And IDA 19 is essentially the largest fund within the bank that supports the poorest countries that we work in. And so to have in IDA 19 a policy commitment that specifically mentions disability data and actually goes beyond that to recognize the importance of the use of the Washington Group questions was actually a very big advancement for us as an institution. And so through IDA 19, that process is taking place because it's a 2-year cycle, and data is being collected in relation to that policy commitment. For IDA 20, which is the replenishment of this fund, we're now looking at a specific indicator or policy commitment on disability data and other groups, other data groups. But in addition to just saying we should use the Washington Group questions, what we're doing now is we're building into that commitment the importance of supporting national statistical offices and building the capacity for analysis, in this respect. So that's very exciting. Another very interesting initiative has been the Inclusive Education Initiative, which is a trust fund that I manage, supported by the governments of Norway and the UK. And under the IEI, what we've been able to do is to support the collection of administrative data. And we're looking at data at supporting inclusive IMIS, so the education management information systems in a number of countries, including Ethiopia and Nepal. So administrative data is an important type of data that we're looking to include in our work, but also we're beginning to drill down to project level data. And so in terms of that, what we're doing is we're undertaking portfolio reviews of the various sectors to see what kind of project level data we are able to get. So for example, under the universal access commitment in the environmental social framework, we were able to drill down to see how many projects capture the issue around universal access and universal design. And so increasingly we're able to do that. Another fundamental part of the work that we do is training staff on better collection of disability data. And to do that, we were able to get some funding from the SDG Trust Fund. And we have been able to have some trainings around better disability disaggregated data. We are also developing an online e-course for bank staff on better collection of disability data. And we have set up a working group within the bank from the different sectors of the bank to advance disability data more robustly. We've also developed a guidebook for World Bank task team leaders on data measurement, on measurement of disability data. And then we've supported specific country governments in their improvement of disability data, South Africa being a case in point. So I just wanted to just say that at this stage, the discussion around disability disaggregated data is very rife at the bank. And I think we begin to see some interesting data coming forward. I'm looking forward to continue to work with Sophie and the team and see how we can build this amazing piece of work that Sophie mentioned, in part was funded by the World Bank's Trust Fund for Statistical Capacity Building, and see how we can advance that to ensure that we have more robust data on persons with disabilities. So thank you very much and appreciate you having me.
Thank you so much. Michael, you have the floor.
Thank you, Sophie. And before I begin, I'd just like to encourage all our participants to submit their questions through the Q&A function, since we will have some time to take them afterwards. Thank you for having me, and thank you for allowing me to review an earlier version of the report. One thing that struck me when reading it, as well as in hearing even my wonderful co-panelists, is just how modest and understated the report is. Some of us have been waiting years for this kind of data, the empirically rigorous comparative data that will enable programming. It's marvelous. It's really earth-shaking, and we use the term too often, but paradigm shifting. So a very big congratulations and many thanks to Sophie and to Jackie and to their colleagues for enabling this work. For those of you who are hopping around through side sessions during this week at the Conference of States Parties, you'll know that it's been repeated over and over again, both by DPOs and by states and by NGOs and by others, that the need for rigorously developed and comparative evidence-based data is strong. And so this is really, really, really important, and it lays the groundwork for a lot of collaborative and real work. In my work, and I've been in 40-something countries, which of course pales to Charlotte and to others, ministers invariably ask for data. Some are more genuine than others in asking for it. Some do so in order to point out they don't have the data, and because they don't have the data on the basics of disability prevalence and incidence, that they're unable to actually do the work that they've agreed to do through human rights and other instruments. Some are genuine in this respect and are asking for help. And the same is true for various development agents. And Marito spoke of the importance of this practically at the state level in the Philippines. So having this kind of data available that's rigorous and that stands up to scrutiny, and that is comparative, because states invariably and development agencies invariably are peer pressured and like to compete with each other on how well they're doing, is invaluable. Relatedly, I'm also looking at how this data is going to enable other aspects of programming and create synergy, a word I'll use a few times. So we have the Sustainable Development Goals, and we are developing data through the SDGs relating to disability. One of the really notable ones is the work that UNICEF has been doing on children with disabilities through SDG 4. But trying to think more broadly about how this kind of basic, foundational, basic data is going to intersect and enable programming under the SDGs. No longer can states say they just don't know how many disabled people they have or what their implications are. I also believe that having this kind of very basic and helpful data can enable the work of the CRPD committee, which often struggles when reporting and reviewing state reports on what's going on relative to the disability community. In the very easiest case, it's a matter of looking at incidence of disability percentages within the country and saying, you know what, the resources you're spending relative to that population are not sufficient. And being able to say that in an empirically rigorous and backed up sort of manner. When we talk about the Philippines and other states, many of them will often try to have their budgets somehow mirror the incidence of the populations that they're looking at. For some countries who have until now, despite the World Bank WHO estimate of 15%, or even the earlier 10% we had at the beginning of the CRPD process are still operating under the assumption that their disability populations are under 2%, which I think is biologically impossible. So having these numbers is helpful even in the most basic sort of way. It's also important to recognize that human rights obligations are cross-cutting, and therefore it's very much appreciated that the report pulls in the notions of multidimensional discrimination, and has a multidimensional dashboard. I hope that it goes farther, but even in future iterations, but even the basic idea of the connection between disability and poverty and its effects on other individuals facing multiple forms of discrimination is enormously important. To come back to the word synergy again, Charlotte spoke very eloquently, as always, about how the World Bank has been working on many of these data-related questions and the synergy between policies, data, financial commitments to programming, and how they all intersect and build on each other. So this work is really important and very exciting. I'll end by being somewhat provocative and note that although this is, econometric data, we still have challenges on their adoption at the national level and also on the process of asking these questions. Even when questions are made uniform, either through national household data or the census that reflects it, it's still at the point of contact, whether in person or over the telephone or through other measures, requires self-disclosure and asking questions in a culturally appropriate manner. And we've had various stories about these over the years. I think it's Dan Mont who originally told me about Yemen previous government, having asked in their census data, does anyone in your household, Allah forbid, have a disability? Or South Africa, even with the Washington group's questions, not wanting to ask about mental health on the notion that it would insult certain individuals, and therefore the skew in the data that arose after that. Or to give you a little story from my world, Bangladesh, which did a national household survey in 2007, right after the change back to civilian government, and USAID was supporting that. And they came up with one prevalence rate of about 5 or 6%. The people that we work with, the DPOs, who went into the Dhaka slums and other places, were coming out with prevalence rates more like 11 to 13%. And when we sat down and spoke with USAID, we came to the conclusion that having someone from Bangladesh speaking Bangla, preferably with a disability, and doing these questions, you came out with different numbers than you did with having, white male Americans from USAID knocking on the door and asking the same questions. And so this brings us full circle back to Jose's point, and that is we need to have DPOs. We need to have people with disabilities themselves involved in the culling of this data, involved in the creation of these data sets. Hugely important. Finally, there's also the kind of philosophical question of how do we figure out in culturally and formally ways the difference between disability and impairment and handicap and what any of those terms happen to mean and how they are reflected in the data. Are there certain conditions, despite the way they're being considered, that some people simply do not recognize as disability? And I think Margaret's remarks touched on this. So I'm very much looking forward to next year's iteration. This is a marvelous project. I'm so grateful to be here with you, and I'm so glad to support in any way possible the development and the moving forward of this initiative.